Okay, so what we're going to look at today is we're going to look at pulse. One of the things I want to point out about this skill is that it is the most failed skill on the CNA test in Florida. I'm not really sure why that might be, but maybe it is because the students don't really know how to accurately take a pulse. So if you're not 100% confident in your ability to take a radial pulse, please go back and watch the video in that link. Look up, if that's not a good video, find a video that will be helpful for you on taking a radial pulse, because that's really the number one thing. And for a radial pulse, you start on the thumb side and you take your index and your middle finger of your dominant hand and you go down. There's a little valley, an indentation. If you just follow the outside of your thumb down, and you'll feel it. And after you get beyond your wrist, if you push there, not too hard, but you just lightly apply your fingers there, you'll be able to feel it. Take a pulse on a lot of different people, because I think that might be the issue, is people are going to this skill and not really knowing how to take a pulse. To see an example, we're going to watch that today. We're going to look at the YouTube video and we're going to go through it. Here is a checklist that I've put together on taking a pulse. If you can, print this out and have it in front of you while we're watching the video, because that'll be helpful, because I'm going to go through it. There's this site, it's called foryourcna.com, and the lady that runs it, Patty, does an amazing job, and she's got it about 95% there. There's little tweaks that I'm going to point out along the way, that if it was me doing that skill, how I might do that skill different. So if you have this in front of you, it might be helpful. But I'm going to point those things out as we go along. So why don't let's get started. Hang on one second. Let me get out of here. Okay, so here is our video. And like I said, we're just going to go through it. And I'll point out the things that I'm not really digging about what she does. But she does she does a great job with this skill. So let's get started. So one of the first things I just want to point out real quick is she's talking about this care plan. And the care plan is just a paper that's going to be given to you, describing to you what skill it is that you're going to be doing and how you'll perform that skill. So that's an example of the care plan. The patient's lying in the bed, and you're going to count the pulse for a full minute. The supplies that you're going to need is, you're going to need a pen. You're going to need a clock so that you can watch. You're going to need a clock so that you can watch the minute go by, so you'll have a way of recording time, and a pen and the document sheet.
Hello?
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm good. How are you?
Wonderful. I need to get your vital signs. Is that okay?
Yeah.
I'm going to close your curtain, wash my...
Okay, so one of the first things that I don't like about what she did a great job. She knocked and she came in and she introduced herself. But you need to ask a patient's permission before you enter their space. Whenever you knock, the next word out of your mouth should be, "Hi, my name is PJ. I'm a CNA student. May I enter?" Because you never want to enter a patient's space without their permission. They could be in the middle of getting changed or having an intimate conversation with a loved one, and you always want to make sure, get their permission before you enter the space. And that's one thing that she doesn't do. In my practice, I would always want you to do that. I teach teenagers, so what I always say is, think about if your parents just walk in your room and they don't knock and they don't ask to come in, and you're right in the middle of something, how mad that makes you. And so always give that patient that dignity of having the option to say, when you say, "May I come in?" They have that ability to say no.
My hands, and I'll be right back.
Okay.
Okay, Mr. Jones, this will take me about a minute. I'll need you to remain quiet during that time, but I'll let you know as soon as I'm done, okay?
Okay.
Okay, ready? Start.
Make sure you understand how to find the radial pulse. Again, we just talked about that. You're taking the pulse for an entire minute. You're not doing 15 seconds, 30 seconds. You're doing an entire minute. So you'll need the clock so that you can see when an entire minute has gone by. And again, the radial pulse is always going to be on your thumb side. And it's going to be right below where your wrist is on your thumb side. She's doing a great job of supporting the patient's hand. She's not letting it dangle, and the patient's arm is supported by the bed. So that part she's doing amazing on. And like I said, 95% of her skill is amazing. There's just little tweaks along the way.
Stop. Thank you very much, Mr. Jones. Is there anything else I can get for you on here?
No, ma'am.
Magazine, perhaps?
No, ma'am.
Okay, your call light is right here. If you should need anything at all, please don't hesitate to call.
Thank you.
Okay, so what don't I like about that? Or what would I do better? It's not that I don't like it. What would I do different? What I would do different is I would never ask about a magazine. First of all, in the skill test, if you ask the patient if they want a magazine, they're going to know that you got all your training from a CNA video. And you don't want to come off as somebody that was trained by the internet to be a CNA. And second thing is magazines, we don't do magazines anymore. That has gone away. That probably went away 20 years ago. Magazines can spread germs, especially COVID now. But this video was made pre-COVID. But even before COVID, I always told my students, never ask a patient if they want a magazine. We do not pass out magazines like we used to just because of the germs factor. So what are some other things that you could ask? Always come up with your own thing. Don't come up with something that everybody else in class is doing. Have your own thing and make it unique to you. Some things that you could ask is, would you like me to get you a schedule from the activity department? Are you comfortable in bed? You can ask them any kind of question that you want, but not about a magazine, because we don't do magazines anymore. And it has to be a preference of them. So would you like more ice water? Like I said, do you want me to go get you a bingo schedule? I noticed that you like to play bingo. Something that gives the patient a say or some kind of preference for their day. But please don't ask about magazines. That's the one thing that I am not really crazy about there.
I'm going to go wash my hands and document.
All right, right before she went to document, the other thing that I'd like you to do is well, hang on one second.
And I'll document my findings. Review the steps of my skill and tell the evaluator my skill is done.
Okay, so before you tell them that your skill is done, before you tell them that your skill is done, what I'd like you to do is, she leaves that overhead table in the middle of the area, and I'll show you. She just says, my skill is done. That's a fall precaution, and the nurse and me can't see that. See, here's her overbed table. That should be tucked onto the end of the bed. You need to take a second before you say my skill is done and make sure that the area is free of clutter and there's no thing that if the patient was to get out of bed that could prevent a fall precaution. And having that overbed table right there like that would be. So what I like to do, I always tell my students to do, is just tuck it to the end of the bed and then push it down into the lowest position. looking around, and you can even say while you're taking your test, I'm making sure that the area is free of any fall precautions as you're moving the bedside table to the end of the bed. That's just a nice way to show, one, that you've been well trained, and the second thing is that you're really trying to promote patient safety. And the other thing is make sure that the patient is underneath a blanket, and that only their arms are exposed. That used to be on the checklist, but they took it away. But I still think it's a great idea is to make sure that your patient is covered up, because that goes a long way towards patient dignity and just making sure that they're covered. Okay. Let's see. And don't forget to document. I've had probably about 6 people perform this skill perfectly. And when it came down to it, the reason they failed was because they didn't write anything down. And there was this one student one year, she was my superstar. She actually trained, she was my assistant trainer, and she would train everybody on the skill. Everybody that year passed their CNA except for her because she forgot to document. So please, and I know that then she went back and took the test and passed, of course, but please, 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 please don't forget to document. All right, let me know if you have any questions.